So I'm Vara Ali, the manager and pharmacist at Warman Freed in Golders Green. I'm here today to talk about health checks. A health check is a series of simple checks that allow an individual to get some personalised information about their individual health. The benefits of it is allows an individual to gain insight to serious problems that may be underlying that they're unaware of, and therefore can take some action towards them. Generally, as a healthcare professional, I advise anyone who's never seen a healthcare professional GP to have a health check, to have one done. But most importantly, it would be individuals with either family history of health conditions, individuals within the age of 40 to 74, because that's predominantly when certain conditions will start to appear, and any individuals that obviously have any other reasons for concern. It's important because, as I said earlier, that you can pick up at an earlier stage things that may be underlying that haven't presented in symptoms. So, for example, blood pressure. It's quite a common thing for people to have a raised or high blood pressure, but because it presents no symptoms, people aren't always aware that they are suffering or having high blood pressure. So by having a health check which will enable a healthcare professional to carry out a blood pressure, we can then diagnose or early detect any raised blood pressure, and the individual can then have treatment or be seen by GP if needed. I do believe that healthcare professionals in all areas, so that's GPs, pharmacists, nurses, and many others, have the capability and the skills to be able to do a health check. It also allows customers to have greater flexibility of where they seek healthcare advice. So GPs, as we know, it can be quite difficult to make an appointment, whereas walking into a pharmacy, you can access a health check pretty instantly and gain some valuable information about your own health. So for an individual, we'd normally recommend at least a yearly health check. That will always pick up things that may have happened in between. Anyone that's got any family history of any other concerns, then by all means go more frequently, but at least once a year. So following a health check, depending on what's been sort of the outcome of the health check, various different routes may happen. So sometimes it can be that everything is fine, so therefore there's no sort of further healthcare professional needed. So an individual can maybe walk away knowing that their lifestyle, their activities and their general well-being is sufficient. If there are outcomes that need referral, as pharmacists and other healthcare professionals that may perform a health check, we can refer on to GPs in order for them to get the right treatment and the right course of action in order to help their individual need. Within Warman Freed, we offer currently a mini men's health check. What that involves is a number of different simple checks that we can perform in the pharmacy to allow, especially the male population, to understand their individual health status. So it involves having a blood pressure taken, it involves having a BMI worked out, and the reasons those two are on there is because, as I said, with blood pressure it's normally undetected. With a BMI measurement, which is your weight against your height, if you are overweight, it can lead to other serious conditions, so we measure that as well. We take a waist measurement, and again that's important for men because the bigger the waist measurement, the bigger the risks of some diseases can be, for example diabetes development. We also have a prostate screening questionnaire. So we don't physically do any examination here, but what it allows is an individual to answer a series of questions that gives us information to understand whether their prostate health may be needing further examination through a GP. So for myself, I think talking to a male, I think it's an invaluable health check because it allows to get the information for them to be able to understand how they are currently and then what they need to do in order to improve their health. So I guess my sort of request and advice to men in the community would be that health awareness is something that we should be more involved in. As a male, there are certain things that do affect you individually that wouldn't affect the obviously female population, and therefore it's important to get the right information regarding your gender. And I would say that it's better to be informed than uninformed, and therefore you can take action and get help and support earlier rather than later. And it's a free service. General services, I think, in pharmacy are a lot more accessible than via other means, and therefore I'd recommend anybody to walk into their local pharmacy, check out what services the pharmacy provide, and actually, get the information to make a difference to your health, because at the end of the day, that's going to be beneficial to you. Generally, most services within pharmacy we try and do as walk-in services as much as possible. Unfortunately, obviously, sometimes with staffing constraints and how busy we may be, we may have to book appointments for some of the services which take a little bit longer. But currently, most of our services we can do on a walk-in basis.